beautiful day to be together. And look at these amazing champions here at this table. Champions for access to care and lowering prescription drug costs for seniors. This is our fireside chat. And it's really wonderful to be here with all of you. I want to give a shout out and a thanks to the Wilmington Senior Center and Sam Nussbaum, the executive director, and his amazing team here for hosting us. I'm Chris Fraser, and it was wonderful to meet some of you this morning. I'm the president and CEO at Westside Family Healthcare, and it's just a real honor to be here and be your moderator this morning for this wonderful panel. Our speakers here today are blockbuster team, and we want to thank the Congresswoman for bringing us all together and hosting. Thank you, our Congresswoman Lisa Blunt Rochester. We have two amazing special guests here with us this morning, our CMS Administrator Chiquita Brooks-LaSure. Round of applause. Thank you. And Lucretia Young, our State Director for AARP Delaware. Well, I'm so excited to be sitting with them here and to be with all of you, really because of what I get to do and the connection each day at Westside. We provide medical care for individuals of all ages, and to be able to know that we have champions who are breaking down barriers to healthcare for all of you is what it is all about. And so we're going to talk more about that today, and I'm so thankful for each of them. This is our fireside chat. And even though we don't have a roaring fire here, we're going to have a roaring discussion. This is an opportunity for us to talk about the Inflation Reduction Act. Did anybody know 2 years ago that the IRA was passed and that we have a champion here sitting at the table? Anybody who knows about the IRA? Raise your hand. All right, we have a few people. Well, that's why we're here today. So the IRA is lowering prescription drug costs for seniors, and we're going to hear about the major ways that this law is saving all of you and all of us in Delaware money and how you can benefit. And so for my first introduction, I'm going to read a little background for each of our speakers here this morning. I'm going to share with you a little bit about CMS Administrator Brooks-LaSure. Chiquita Brooks-LaSure is the administrator for the Centers for Medicare and Medicaid Services, also known as CMS, where she oversees programs including Medicare, Medicaid, the Children's Health Insurance Program, and the Affordable Care Act health insurance marketplaces. Thank you. A former policy official who played a key role in guiding the ACA through passage and implementation, Brooks-LaSure has decades of experience in the federal government, on Capitol Hill, and in the private sector. As a Deputy Director of Policy at the Center of Consumer Information and Insurance Oversight with the Centers of Medicare and Medicaid Services, and earlier at the Department of Health and Human Services as Director of Coverage Policy, Brooks-LaSure led the agency's implementation of ACA coverage and insurance reform policy provisions. Earlier in her career, Brooks-LaSure assisted House leaders in passing several healthcare laws, including Medicare improvements for patients and providers of 2008, and the ACA as part of the Democratic staff for the House of Representatives Ways and Means Committee. Brooks-LaSure began her career as a program examiner and lead Medicaid analyst for the Office of Management and Budget, coordinating Medicaid policy development for the Health Financing Branch. Her role included evaluating policy options and briefing White House and federal agency officials on policy recommendations with regard to the uninsured, Medicaid, and the Children's Health Insurance Program. Another round of applause for the lady.
Well, thank you so much, Chris, for that warm welcome. And just a good morning to everyone. We've already had just such a lovely day here in Delaware. And I was just saying to Chris, it feels like every time we go to an event that it's like Congresswoman Blunt Rochester is with her family. As she does still with Delaware just has such a warm feeling. I really want to thank her for bringing us here together today, and just a thank you again to the Wilmington Senior Center for hosting us. As Chris just said, I'm Chiquita Brooks-LaSure and the administrator of the Centers for Medicare and Medicaid Services, which, among other things...
Would you bring up your volume, please?
Oh, sure. Thank you for saying something. Yes, can you all hear me? Is that better?
Yes.
Great. Okay. Would you prefer if I stood? Can you all see me?
You better look at me, guys.
Oh, sure. I was changing that.
That way we can quickly see how beautiful you are.
Well, thank you. Honestly, it really is a pleasure to be here with you and to talk about what the IRA is, which had some climate change things, but I call it the new prescription drug law because it really is life-changing. The president worked so hard with Congress to pass changes to Medicare prescription drugs. And I know I don't need to tell you, but I think for so many of our nation's seniors, for people with disabilities, prescription drug costs has become the #1 issue. I met a family in North Carolina, a couple the husband's costs were over $18,000 a year. And he and his wife talked about just the struggles with thinking about retirement. I talked to my own parents, and they tell me how their friends really feel like one of the spouses cannot retire because they're worried about the prescription drugs for that spouse. I just met a woman who had been recently diagnosed with leukemia. The cost of one of her treatments, $12,000. And that was 13% of her income. And so it is my pleasure to talk to you about what this new prescription drug law means. The first things that have already gone into effect are free vaccines, and that includes the shingles vaccine, the ones recommended by the CDC, and a $35 monthly cap on each covered insulin. This year, in effect today, it's a cap on catastrophic costs. So the woman that I just mentioned was $13,000 for one treatment. She no longer has to pay all of that out of pocket. And this is the first time that Medicare has had a out-of-pocket cap for prescription drugs. And seniors all across the country are starting to hit that cap. And next year, that cap goes down to $2,000 for everybody. Another really important provision is expanding extra help. Extra help is available for modest income seniors, and not as many people who are eligible for it are enrolled. This new law made more people eligible. So individuals who make about $23,000 a year, couples if you make less than $31,000 a year, and you have limited assets, you are eligible for expanded extra help, which means that your drug costs are minimal.
Can I ask a question real quick?
Sure.
And you're clean through loud and clear, saying,
Okay, that's fair.
does that mean all these benefits are available irregardless of our insurance plan that we have?
That's right. So if you are enrolled in Medicare prescription drug coverage, you have to enroll in that piece, which most seniors are enrolled in, but not everybody. So whether you have Medicare Advantage, whether you are in traditional Medicare or original Medicare, and you get Part D coverage, you are eligible for these things. So I will stop here because I could keep going, but these are the most important provisions that I wanted to make sure that we cover, and that's really looking forward to our conversation.
Thanks so much, Administrator. And now I'd like to introduce our very own U.S. Representative, Lisa Blunt Rochester. You all know her and the amazing work that she's doing. Thank you, Congresswoman, for your service in the Capitol for us. In addition to that work, your work in the House and Energy Commerce Committee, and we know the impact that House is so appreciative We appreciate all that you've done here in Delaware. Without further ado, I turn it over to you.
Thank you.
Thank you, Chris. Okay, so good morning, everyone. Good morning. And so I told Chris to abbreviate my bio, that you don't need to know all of that. Let me just tell you why we're here. First of all, I want to thank Chris and Westside. I want to thank AARP for their partnership. I want to thank the Wilmington Senior Center for hosting us. And I really wanted, I want you to understand who this woman is.
Yeah.
Administrator Brooks-LaSure heads up Medicaid and Medicare for the whole country. For the whole country. And so when she said she wanted to come to Delaware, she said, what do you want to talk about? And I said, what I want to talk about is making sure that our seniors know what they're eligible for and the incredible transformational bills that we just passed. Because a lot of times we hear the names of stuff, we don't know what's in it.
That's right.
We don't even know we're entitled to it. And so it is really important for me to make sure that you know, number one, your voices were heard. Because in the past 8 years that I've been in this job, we did a roundtable on insulin. And people told us they were skipping days because they could not afford insulin. And we have passed legislation to cap it at $35, not $600, not $1,000, $35. People need to know about that.
Amen.
People said to us, our drug prices are so high in this country. You go to other places in the world, on average, for every dollar that other people are spending in other countries, we spend $3.
Correct.
On average. And in some places, we spend 6 times more, depending on the drug. And so we fought to be able to negotiate for drug prices. If we can negotiate for an airplane, why can't we negotiate for drug prices? So I want you to know the things that you are eligible for. And also, for those who just don't have the means, there is extra help. Low income, extra help. We want to make sure you know what you're entitled to. That's really why we're here today. And so we'll talk a little bit about that. But I just wanted to get real clear. She's the bomb. And there are things that you are entitled to that we're going to make sure that you get yours. That you get yours. And we talk in our office because sometimes the terms don't make sense. We went to a town hall with some seniors, and the way it's all written is that there is no cost share for seniors on Medicare for your vaccines. And everybody was quiet. They were like, what does that mean? I said, your shingle shots are free. People know what free is. You might not know no cost share, but you know what free is. So we want to also make it plain for you. And if you don't get the answers to every question here today, we'll be here. We've got staff here from my office. We'll be able to connect with you afterwards. But today is about information and making sure that you have it, okay? Y'all got that? Yeah. I'm doing my best, Ted Blunt, okay?
Thank you. So in the spirit of allowing you all to have some more time to talk, I'm going to ask Lucretia if it's okay if I abbreviate your bio as well, but you need to know who is also sitting here at the table. We have Lucretia Young. She's the State Director for AARP of Delaware, and she is a force. And so we're going to talk about what she's been working on with all of you for a long time. But just so you had a little bit of background, as State Director, Lucretia is responsible for developing AARP's presence in the community with the state and establishing a network with all of us and also state and local partners. She is making AARP of Delaware a driving force, and she is a tireless advocate for those who are 50 plus and their families to live their best lives. And so how about a round of applause for Lucretia?
So I'll say good morning too. And I'll make my comments brief. First of all, how can I come after our comments? Like this is, like next time, just put me like on the other side. We have a first here in Delaware, don't we? Yes, we do. First here in Delaware. I just want to say that, and also, Chiquita. I want to say that, Chiquita. Right. I also want to say, $1 trillion budget, 6,000 employees, the force.
That's right.
A force, that's amazing. She's an amazing force. For many years, to lower the cost of prescription drugs for seniors. This has been our mantra. We finally helped to push this across the finish line. And this conversation today is very important because the IRA, the Inflation Reduction Act, is monumental. The trajectory from it is going to change the landscape of America in years to come. It's going to change the way the quality of life is in our homes. There's a lot more information, and all I want to ask is that take some notes, and as our Congresswoman said, we're here to talk to you afterwards, and then you be the panel. When you leave here, you talk to your churches, talk to your families, give them the AARP.org or the HHS, whatever. Give them the information so they can find out about this new law that is impacting your lives. And the final thing I'll say is my biggest pet peeve is the fact that there are so many underserved people in this country and so many communities that are marginalized and do not get this information. And as the Congresswoman said, it's not even in layman's terms. It's like 2,000 pages of bills and that people can't understand. And so this was strategic in bringing it here. So thank you. I'm honored to sit with both of you. Thank you again, and enjoy the rest of the panel. Just let one out, so I'm gonna come big mouth. Did you tell me some nice?
All right. Lucretia, thank you so much. Okay, we're going to turn back to our panelists and administrator. We're going to send this one your way. We know, just like we talked about, that many of us are really unaware of the provisions of the IRA, but we do know that our Congresswoman and both of our senators here in Delaware championed signing this law that our President Biden signed. This is 2 years ago, and we would like to maybe have a recap, and if you want to hit the high notes again of the big changes that we should know about.
I hit several of them. I'm going to go back and explain just a little bit more about extra help because it is so important, and I will tell you the Congresswoman has so championed extra help, among other things, but really making sure that we are doing a better job of getting out the word. So I mentioned extra help. It is available, so the average person who is dependent on Social Security is going to be eligible for this extra help. If you want to check and see if you're eligible, you can go to our website, you can go to Medicare.gov, you can go to SHIP like Eliza Boat, which is a group of counselors who give unbiased advice to you about coverage. Wanted to make sure I was clear about where to go for more information. But the kinds of things that it offers is no deductible, which means when you go to the pharmacy, you don't have to pay up front. They should give you the drug for a couple of dollars. So most drugs are going to be under $10 to you. And that is a huge difference from what you would pay if you were enrolled in the regular Medicare program. Again, I think the catastrophic cap is one of the most life-changing of the provisions in addition to the shingles vaccine. There are a couple of other pieces. One is the inflation rebate, which, what does that mean? It means if the drug companies keep raising the cost of their drugs, they have to pay us back. And that helps lower your costs. And that is already in effect where it's starting to either cause the drug companies to spend less money or they pay us, the federal government, a rebate. And that in effect helps lower costs across the seniors that take them. And the Congresswoman also mentioned that we are right in the middle of negotiating drugs. So we are in the process as we speak. The 10 selected drugs are for drugs for cancer. They're for drugs for diabetes. They are for drugs, things like Crohn's disease. And this is where we're starting, where we're trying to get a better deal for all of you and the federal government so that we can pay for all these additional benefits that we've been talking about.
That is the question. I'm a bit confused when you say they have to pay, the big pharma has to pay back.
Yes,
They're paying back to the federal government.
they are, yes.
Do you really feel confident that that will trickle down to us?
It does. So when they have to pay a rebate, it lowers how much a senior pays out of pocket. And so it's a lot of math, but what it comes down to is when they have to pay us, they also have to charge you less.
That's your
Great question. Thanks, Administrator. Congresswoman, with your leadership on the Energy and Commerce Health Subcommittee, would you like to take that a little bit further and talk about impacts we're seeing here in Delaware, or shift to where you think at some point people will see their costs coming down here in Delaware with these negotiations?
Thank you.
Thanks, Chris. So first of all, as Chris said, when you go to Congress, you get to be on different committees. Some people might choose judiciary, and they're working on, things like, I have a bill called Clean Slate to help returning citizens, but I'm not on that committee. I'm on the committee called Energy and Commerce, which has the environment, it has trade, but it also has healthcare. And so I was there at the very beginning of these conversations about how do we lower costs. And some of the things that we look at in our office is what will be the impact on Delawareans when we do this. So for example, we're estimating about 63,000 Delawareans will save $449 per year on their prescription drug costs because we passed this law. That means that somebody can do something else with that money. We know it is a tough time right now. And people need every single bit of dollars they can get back in their pocket. And so the bill, the Inflation Reduction Act, which you hear us keep talking about, it is sort of like people probably didn't pay attention to the word Affordable Care Act when it first came out. And then it was like, how do I sign up for Obamacare? We're trying to get this word out to let you know all these different pieces of this because it affects you in different ways. And so we know there will be real impacts to Delawareans because we passed this. And that's part of what we do as an office is to figure out how can we get the word out. Another thing, we look at what is the total amount we'll save because as the administrator said, then we can make sure that it lowers your costs when it comes back to Delaware. There's going to be a lot of changes. She mentioned we start with 10 drugs that will be negotiated. Those are like the biggest ones that affect the most people. Many of you might know that when my dad passed from leukemia, the cancer drugs are so expensive.
Yes.
We got a lot of people that are diabetic. These are the kinds of things that we're starting with. Then they will go to the next round of drugs that will be negotiated. That cap on how much you pay out of pocket, the administrator talked about catastrophic. What that is because a lot of times we read our, to try to get a plan, we don't really know all the words of what it means is all of a sudden you have to have a major surgery, and you correct me if I'm wrong, but you find out you have to have some major surgery and it's going to cost a lot of money. And to think about how do we cap those costs to you? We're starting initially at $3,500. Is that correct?
So
Explain this,
I will
because this is important. Like, think about it. If you had to pay $10,000 versus $2,000 for a major, so go ahead, Administrator.
So the cap is on prescription drug costs. So what happens right now, if you have prescription drug costs, eventually you pay a little bit less, but you still pay out of pocket. This year,
Like a cancer drug that could cost you $17,000.
that's right, like you have to keep
Which is
paying.
what we've heard.
Now, the cap, it depends exactly on your plan, but it's about $3,500 to $4,500. So there are people in this country who are already hitting the cap and they no longer pay anything out of pocket. Next year, that's when the cap is $2,000 for everybody. So this year, it's if you have a lot of drug costs, again, around $3,500 to $4,500, depending on your plan. But next year, it's $2,000.
That's a big deal. That's a big deal because a lot of people, they lose their house
Yeah, that's true.
because they can't pay for these drug costs.
Yes, I have one more question. I'm sorry to wear you out. A question.
That's why we're here.
For the team.
This should it well, or should it, am I saying that right?
Administrator Brooks-LaSure.
I got what's my champion. I like to be proactive since I am pinching every penny till it screams. I don't know how to put this, but wanting to be proactive, I want to know what it's going to cost before I have to pay it. Can you speak to that? Yes.
Meaning sort of like getting the information from whether it's the hospital or for ahead of time.
Right, that would really be helpful. And I have that catastrophic, I had a triple binding, and fortunately I have good insurance backed up by Medicare. So, but it would be nice to have a little information ahead of time, and I have no idea how that could happen.
Well, there are a couple of ways that you can get more information ahead of time. During Medicare open enrollment is the time when we put out, so we send out Medicare and You, which is an overview of all of the issues. But as you are enrolling in your coverage, the plan will send information. And that is where we are requiring them to educate on all of the things that we are talking about. But I would say we're one place. AARP does an incredible job of giving a lot of information out. So does SHIP Health. So does your Congresswoman's office. But you should let us know if there are things, and my team is back there as well. Kyla's waving her hand. Feel free to come by and we can get you some further information.
Thank you, appreciate it.
You wanted to ask what's the timeline? No. Oh, you should have asked him because we're running out of time. But I do want to say to your question, today we're here talking about lowering prescription drug prices, but part of your question is about transparency. How do we see what we're being charged? On the health subcommittee, we had a whole hearing where we talked about making sure you know what from hospital to hospital even. So that you might say, I might want to go to this place because it's cheaper or the outcomes are better. So part of your question is about transparency. We can follow up with you on that as well. Okay?
Yep.
Thank you so much. Do we have another question that was here in the audience?
Yes. On the Jordan, I have already been in my money. Not a bunch of bank to see, you know, and I had on this extra money in there, and they took finally had the initial on it, what they guess that's it happens, and for what I did, it's the not appearance, it's whatever, but it is. Now, but this rebate, that's still not well, that's we get this role. Can we get that increase? An increase in
They're talking about an increase in SSIs.
Yeah.
Question.
Social security.
which part? You know, like, now there's still the bank giving some more. Will that be increased to me still?
I'm not sure. We can follow up, but what I'm talking about is specific to healthcare, so we can check it. Yes.
And we'll turn it over to Lucretia.
Yeah, I'll have my team follow up with you. What's your name?
Marguerite.
Marguerite.
Nice to meet you.
I'll have my team to follow up. If I could just say, for sake of time, real quickly, that I just want to talk about caregiving. How many people in here have taken care of someone? There you have it. AARP has been fighting for the rights of our 48 million caregivers in this nation for years. In Delaware, any given day, there are 125,000 caregivers and growing. That constitutes nationwide $600 billion in unpaid care. In Delaware alone, the caregivers spend, on the average, 26% of their incomes. Some of them have to work part-time, have to shift their job times, and work in the morning or at night to take care of their loved ones, which is honorable. And it is valued at $1.9 billion, the amount of care that is given. And last year alone, they provided $116 million of unpaid care. So what does that mean? That means that this bill, the Inflation Reduction Act, will be so important and so monumental for those taking care of their loved ones. Because really, this is personal, it's financial, it's your health care, and your caregivers that are taking care of their loved ones are struggling. They're going through it, and we know that. I just wanted to mention, piggyback on what our Congresswoman said. When my mother, may she rest in peace, was on Eliquis 8 years ago, I was appalled at the cost of Eliquis. I mean, fortunately, me and my brother and sister could make sure that she had her medication, but even that sometimes was a bit of a struggle because she needed so many medications. But I was appalled. And so Eliquis is actually the first drug, I believe, that was approved for Medicare negotiations when they lowered the cost of drugs. Also, I wanted to ask our administrator if she could talk about the smooth cost sharing that some folks may not be familiar with. If you have an expensive drug, the $2,000 out of pocket, the smooth cost sharing that we're asking for.
Yes, I would be happy to talk about it. So back to your question of, I like to know what I'm going to pay up front. There is a provision of the law that says if you have high drug costs, we will smooth out those costs over the course of the year. It is a good deal for some people, especially if you have higher drug costs and you want to know what they're going to cost every year. We are going to be rolling out that provision this open enrollment, and your health plan will give you information about it to make sure that you can think about it while you're at home, thinking about whether it makes sense for you. And so can you guys remind me what we call it now? The Medicare payment sharing. So we have a specific name for it. I'll get it for you all. But this fall is when we will put out a lot of information directly to people about the smoothing permit.
The domestic.
Medicare prescription payment plan.
The Medicare prescription payment.
Let's see. You repeat that again.
The Medicare prescription payment plan.
Okay. I think it was an awkward thing.
Thank you so much. I'm looking at our time and some of the questions we have left, and I don't know if we want to cover free vaccines or some of the other work that you're doing, Congresswoman.
We've discussed a little bit about free vaccines, but what I want to say as a follow-up to this, what we want to put together is just kind of a little cheat sheet for you with some of the websites and the places that you can get information and that you can share with others, because this is a lot to retain. Also, to your question, we have Health and Social Services, Department of Health and Social Services is here along this wall. And so if anybody wants to, wave your hands. Yes. Come over, and visit with them. Especially because when I started back in 1988 as an intern and worked in Congressman's office for Tom Carper, I did casework and I did Social Security casework. And so as you were talking, I was thinking about some people are on SSI, some people are on SSDI, some people are on Social Security. We want to make sure we still have those things in order to support our seniors. We're fortunate with Social Security. Historically, we've had cost of living adjustments. Yes, the COLA, that's important. But we also know we have state programs. So we want to make sure you know what the resources are. We'll follow up with you on that. Again, the most important thing we wanted you to know is reach out and ask, what am I eligible for? You know your particular situation. You know if you are on Medicare, you know your own situation, but we also wanted to make sure you have resources to tell your neighbor, tell your friend. Thank you to the Wilmington Senior Center for even making this opportunity possible, but we gotta spread the word.
Right.
Because like I said, if you don't know about it, you don't have it.
Right.
And so we wanna make sure that you know about these things. Yes, ma'am.
I was on Medicaid and I was in there for 4 years and I didn't have to pay. So now I got to pay. So why did this?
So again, each one of you has your own story and your own question. So some of us will be here. Krista Weed in the back, stand up please. Krista Weed in the back works in our office. She heads up all of the constituent casework. DHSS is along this wall. Westside Health is here. And then the administrator and AARP have resources as well. So on your specific questions, you've now got contacts right here in this room. So we can make those questions answer your questions. Great questions too to help clarify things for people. So don't ever be ashamed to ask a question because you asked a question, 5 and 10 other people wanted to know too. So thank you for your questions as well. And Lucretia Young from AARP wants to say another thing as well.
This is real quick. One of the things AARP works on constantly. Okay, she asked me to state that. Okay, all right. See how these AARP members are? And you're one of 190,000 plus members in this state. And we have the largest penetration of membership of any state in the nation here in Delaware. One of the biggest issues that we find in AARP is navigation. Remember there were blue pages, you can go into blue pages in a phone book, you could find different services. The hardest thing right now is navigating services. So I'm so pleased with what the Congresswoman said. AARP.org, and if you get our bulletin or our magazine, we're using all of our resources to put this information out there. Also, Sheila Graham here, my policy director, takes the pictures. She can answer some of these questions when we're talking about the COLA, Medicare, and Medicaid. Actually, she's a nurse by training, but now she's my daughter. But she has so she can answer some of your questions. We can take your information. But navigating services is very, very hard. And what we see at AARP is a medicine can't help you if you can't buy it. It just doesn't matter how many medications they make. It can't help you. We believe in innovation. We believe in investment in medications. But it can't help you if you can't afford it. And if you can't find it, and you can't find your way. Delaware offers a lot of good resources through Health and Human Services. And then there are a lot of good federal resources too. So just reach out. Thank you.
Thank you.
And as a 62-year-old this year, I'm fighting for Medicare.
Yeah. All right, we're going to close up now. Administrator, we want to thank you again for coming to Delaware. I'm final word is what you got to people to take away from this, and Congresswoman, if you would take us. Okay, all right, Administrator.
Just to say how thankful I am to be here with you. It is so important that we hear your questions, and it reminds us what we need to do better in terms of communicating. What I most want to say is that President Biden, Vice President Harris, and Shakita Brooks-LaSure are listening to you and trying to do the best things that we can to improve the Medicare, Medicaid, and CHIP, and marketplace coverage for everyone.
Yeah.
Thank you. All right, we thank you all. Thank you again to our hosts here today, and thank you all for your amazing questions. We'll be here to spend a little bit more time with you. Our guests, we'll give them another round of applause.
Thank you.